Hi, good morning Shane. My name is Scarlett Midfield. I'm your invigilator for the OET speaking session on the 23rd of July 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Shane McMillan.
And what is your candidate number, please?
My candidate number is 232092127.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
To what extent do you think the COVID-19 pandemic has impacted society?
There is no doubt that COVID has significantly impacted people worldwide. From the loss of jobs, leading to financial struggle, fear of the unknown, and significant loss of life, I believe, we will feel the effects of this tragic pandemic for many years. However, the care the World Healthcare has done during the pandemic is astonishing, and the development of vaccination also shows the strength of medical sector.
What are some ways you think we can reduce modern-day diseases and prevent this major healthcare issue?
I believe education and prevention are the keys to reducing the number of deaths. We must educate patients and their caregivers on healthy lifestyles, including eating a healthy diet, exercising, and avoiding behaviors such as smoking and using recreational drugs. In doing so, we empower them with the knowledge they need to prevent, or at least reduce, the risk of these diseases, thereby reducing the death rate.
What do you think is a major contributing factor to the rise in healthcare costs?
I must admit, I don't know a lot about how healthcare costs are figured out, but I have read about some issues related to rising healthcare costs. The studies I've read cite preventable medical errors as one of the most common healthcare and nursing mistakes, driving up the cost of healthcare for everyone.
What will help you to promote your success in your nursing career?
I have great interpersonal communication and relationship building skills. As I continue to learn how to be an effective team member and develop leadership qualities, I think those skills will strengthen and help promote my success in nursing.
What will you do if a patient continues to be reluctant?
I always want to do whatever is best for my patients and help them recover when possible. So, if my patient's wishes do not align with what is best for them medically, I can see where that may be challenging. However, I understand the importance of a patient's right to decide about their care. If something is medically beneficial for my patient, but my patient refuses the care, and I know he has enough information to make an informed decision, I will honor his wishes.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning, Scarlett. My name is Shane McMillan, one of the nurses working in this ward. How are you feeling now?
Good morning, Shane. I'm all right. Thank you for asking.
Good to hear that. Well, I can see you are concerned. May I know the reason behind that?
Actually, nurse, I anticipated that I would be discharged from the hospital within 2 to 3 hours. Suddenly I realize, not only that I have had a fright, but also asthma attack. Moreover, I have never had an asthma attack before.
I realize your concerns. Try not to worry, Scarlett. You will be all right. At present, you are under observation. Afterwards you will be discharged. By the way, do you have any questions regarding asthma?
I just know little about asthma. Can you please explain to me about asthma?
Of course, I will. Asthma is a chronic disease which affects the airways. In this condition, a person's airways will become inflamed, narrow and swell, and produce extra mucus, which makes it difficult to breathe, and trigger coughing, a whistling sound or wheezing, when you breathe out, and shortness of breath.
Okay, I got it. And I wonder how it is caused.
I appreciate your consciousness. Surely, I will explain the causes of asthma in detail. Exposure to various irritants and substances that trigger allergies can trigger signs and symptoms of asthma. It is important to note that asthma triggers are different from person to person.
All right, I understand that.
That's perfect. Some of the environmental causes include airborne allergens, such as pollen, dust, etc., respiratory infections, like the common cold, or due to cold air pollutants, etc.
Okay.
Other causes can be physical activity, strong emotions and stress, influence of certain medications, as well as gastroesophageal reflux disease, in which the stomach acids back up into your throat.
All right.
In addition, your inherited genetic makeup predisposes you to having asthma. It's a true fact that, if a person has a parent with asthma, they are 3 to 6 times more likely to develop asthma.
So, there are many causes that trigger asthma.
Yes, Scarlett, you are right.
Nurse, I have even heard stories about people dying from asthma attacks.
I acknowledge your words. Although asthma is considered a chronic disease, the large majority of patients have good control of the disease, if prevention measures are applied, and the inhaled treatment is done correctly.
Oh, really?
Definitely, Scarlett.
Then nurse, how can it be treated?
Your question is reasonable. In this situation, the most effective way is to open the airways to breathe efficiently. The most common means is to use an inhaler, a Ventolin inhaler, that is, salbutamol.
Okay. But could you brief me how to use it?
It is easy to use as well. Shake the inhaler hard 10 to 15 times before each use. Then hold the inhaler with the mouthpiece down. Place your lips around the mouthpiece. As you start to slowly breathe in through your mouth, press down on the inhaler 1 time.
Okay.
Take the inhaler out of your mouth. If you can, hold your breath as you slowly count to 10. This lets the medicine reach deep into your lungs. After this, breathe out slowly through your mouth.
To be honest, I am quite anxious about the proposal to use a Ventolin inhaler. That is just because people have told me about its misuse.
Your anxiety is reasonable. I agree with what you have said. Even though the inhaler is being misused by some people, its therapeutic purpose cannot be neglected. Especially for an asthmatic patient.
Yes, I understand what you have said. Well, I would like to know the long-term prospects now that I have had an asthma attack and been held in hospital overnight for observation.
It is a sensible question. Currently, you are being held in the hospital for observation purposes. After the complete assessment, and once you feel fine and settled, the doctor will discharge you. Thereafter, please follow the treatment protocol as per the doctor's advice, and take inhaler as prescribed, to avoid further recurrence.
Surely, nurse.
Moreover, I would like to reassure you that, if you manage the symptoms effectively, and follow doctor's instructions, asthma can be controlled to a greater extent, thereby reducing the chances of asthma attacks in the future. I hope it releases your anxiety.
Yes, now I am a bit settled. Thank you for clarifying my doubts.
Glad to hear that. I wish you a speedy recovery.
Thank you. That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.